You probably know about Medical West's freestanding ER right off of Highway 150 in Hoover. But what you might not know is that a convenient walk down this sidewalk will take you right over to the Hoover Health Center. Now there you can meet with any family medicine physicians and also orthopedic physicians as well.
That's where we caught up with Harveen Sodhi, one of Medical West's newest family medicine doctors. Now, because Dr. Sodhi is passionate and encouraging open dialogue about vaccinations with her patients, we asked her to weigh in on the discussion surrounding the resurgence of measles in the United States.
It does come as a surprise that this is the highest number of reported cases since 1994. And then after that, we eliminated it, and now we're here.
Measles is a virus that's highly contagious and spreads very rapidly.
One infected person, it can actually spread to up to 90% of non-immunized people if they're just in the nearby surroundings. It spreads through the air. So if you cough or if you sneeze, it can actually last up to 2 hours in the air or on a surface. So when you hear things like that, it kind of puts it a little bit more into perspective.
Complications from measles can be extremely dangerous, especially in children. That's why Dr. Sodhi says prevention is so important and vaccinations are key. For some, anti-vaccination concepts can cause hesitation on whether or not to vaccinate. Dr. Sodhi encourages open dialogue.
I think a lot of times there's an assumption of a provider versus patient, but it's more of a partnership. If you have hesitation, or if you do find literature, if you don't, but you have a concern or question, go to your provider, because I'm supposed to be able to have that conversation on both sides. With so much globalization and ease of just jumping on a plane and going places, we have to be a little bit more informed, or at least talk to your doctor instead of, my kids aren't gonna get it, we're not gonna do this, and then you go somewhere and then suddenly self-protection, but also kind of like a public service as well.
The CDC recommends all children get 2 doses of the MMR vaccine, starting with the first dose at 12 to 15 months of age and the second dose at 4 to 6 years of age. Dr. Sodhi is currently accepting new patients and walk-ins at Medical West Hoover Health Center. Visit medicalwest.org for more information. For CBS 42 Living Local, I'm Lillian Lalo.